All right, let's talk about something that is really making waves in metabolic medicine. There's a new drug on the horizon, and even though it's still in trials, the kind of data we're seeing, well, it's making everyone, from researchers to doctors, sit up and pay very close attention. So let's dive right in.
We've gotten used to hearing about these big breakthroughs with drugs like Ozempic and Mounjaro, right? They've been game changers. But the early numbers coming out for this new contender, they're just on a whole other level. This isn't just an incremental step. We are talking about a massive leap forward.
And it all comes down to this one number, 24%. Just let that sink in for a second. This is the figure that has the entire medical community buzzing, and for good reason. It's an absolutely staggering result for obesity treatment. But here's the kicker, the really crucial part. That 24%, that's not some best-case scenario for one person. No, that is the average amount of body weight that people lost. And they lost it in just 48 weeks during a clinical trial. I mean, to put that into perspective for you, that's getting into the same ballpark as the results you see from some types of bariatric surgery. That's just wild. So you can see why this is such a big deal. It really forces us to ask the big question, the one we're going to explore today. With numbers like that, are we looking at what could be the single most powerful weight loss drug ever invented? Let's get into the science and see what we find. Okay, so the name of this potential new king is Retatrutide. It's being developed by Eli Lilly, and you can really think of it as the next generation of these metabolic drugs. It takes everything we've learned from its predecessors and then adds a really powerful new twist. So what exactly is this stuff? Well, technically, it's a synthetic peptide, but the magic words you need to remember are triple hormone receptor agonist. That's the secret sauce. This is what makes it totally unique. Instead of just targeting one or two hormone pathways in your body, it goes after three of them all at the same time: GLP-1, GIP, and a really interesting one, glucagon.
Okay, so how does this triple action engine actually work? I mean, what's going on under the hood? This is where things get super interesting, because it's this three-part mechanism that's unlocking these kinds of results we've just never seen before. A great way to think about it is like this. Imagine your body's metabolism is controlled by a panel in a cockpit. And on that panel are three really powerful levers. The older drugs, they were great. They could pull one lever, maybe two. But retatrutide, it comes in and pulls all three of them at the exact same time.
So let's break down those levers. Lever number one is activating GLP-1. Now, if you've been following this space, this one will sound familiar. It's the same mechanism in a lot of other successful drugs. It basically tells your brain you're not hungry, and it slows down your stomach from emptying, which, you guessed it, makes you feel fuller for way longer.
All right, lever number two, GIP activation. This one is all about helping your body handle sugar better. It improves your insulin response right after you eat a meal, which means your body gets way more efficient at managing the energy it gets from your food.
And now for the third lever. This is the real game changer, glucagon activation. This is the part that truly sets retatrutide apart from everything else. This lever actually tells your body to ramp up its energy use, to literally burn more calories and more fat. It's like turning up your body's thermostat, a totally unique part of the puzzle.
So when you put it all together, you can see the incredible synergy, right? First, you're eating less because you're not as hungry. Second, the food you do eat is being managed way more effectively by your body. And third, your body is actively burning more energy. It's this perfect three-pronged metabolic attack.
Okay, so the science, the theory, it all sounds amazing on paper. But what about the proof? Do the actual numbers from the clinical trials back all this up? Well, let's take a look. And wow, do they ever. We've already talked about that incredible 24% weight loss number. But look at this other one, an 80% reduction in liver fat. That is just staggering. It shows that this drug isn't just about the number on the scale. It's having a deep, profound impact on overall metabolic health, especially for something as serious as fatty liver disease.
And if we zoom out a bit, you can see just how broad its effects are. It's not a one-trick pony. On top of the weight loss, you're seeing huge improvements in blood sugar control for people with type 2 diabetes. And again, that massive drop in liver fat for people with NAFLD. It's hitting all these interconnected metabolic problems at once. Okay, but with any drug this powerful, we have to be realistic, right? We have to flip the coin over and talk about the risks, the side effects, and just the reality of where things stand. Because, let's be honest, there's always a catch. So to really understand how powerful this is, let's put it head-to-head with Mounjaro, also known as tirzepatide. Now, Mounjaro is an incredible drug, a dual agonist. It pulls two of those levers we talked about, and it gets amazing results, around 21% weight loss. But retatrutide, with that third lever, that triple agonist action, it just pushes the results even further, getting up to that 24% mark. So what about those side effects? Well, if you're familiar with this class of drugs, they're not going to be a huge surprise. We're talking mostly gastrointestinal stuff, nausea, vomiting, diarrhea. The key thing to know is that they seem to be dose-dependent, so the higher the dose, the more likely you are to feel them, and for most people, they tend to get better as your body gets used to the medication. Now, this next part is extremely important, so listen up. There are what we call absolute contraindications. That means certain people should not take this drug, period. Specifically, anyone with a personal or family history of a specific type of thyroid cancer called MTC or a rare genetic condition called MN2. This is a standard, serious warning that applies to this entire class of drugs. And maybe the biggest reality check of all, you can't just go ask your doctor for it. Not yet. For all the incredible results we're talking about, Retatrutide is still officially an investigational drug. It's in the middle of these huge, super important phase 3 trials to make absolutely sure it's safe and effective in the long run.
So, what happens next? What's the timeline look like? When could we actually see this thing go from a trial to a treatment you can actually get? Let's look at the road to approval.
So the whole story really blew up in 2023 when those phase 2 results came out. As we speak, those massive phase 3 trials, they're called the Triumph trials, are happening. The big milestone to watch for will be in 2025. That's when we expect to see all the data from these final trials. And if all goes well, that could mean we're looking at a possible FDA approval sometime in 2026. And that really brings us to the big picture here. When you look at all the evidence, it's pretty clear that Retatrutide could be so much more than just another weight loss drug. I mean, by hitting these 3 metabolic pathways at the same time, it has the potential to completely change how we treat obesity, yes, but also a whole host of conditions that go along with it. So the question we're left with is a big one. Is this it? Is this the drug that's going to redefine the future of metabolic medicine? Only time will tell.